If you're in a relationship with a narcissist that shows absolutely no sense of accountability and no sense of changing, the prognosis for that relationship is pretty poor.
Hi, everyone. Welcome back to the channel. Today, we're talking about a super interesting topic, narcissism, and we have a special guest, Dr. Shah. She's a board-certified psychiatrist. She is also fellowship trained and board-certified in child and adolescent psychiatry. She did her residency training at Jefferson Hospital in Philadelphia and then completed her fellowship in New York. Welcome, Dr. Shah. Thanks for being here.
Thank you for having me.
So for everyone who wants to know, we're going to have a little bit of a different dynamic because this is actually my cousin and we're very close. But I do want to actually formally interview her on narcissism because it's a topic that I'm really interested in. And I know we've all had to deal with narcissists in our lives. So I'm going to jump right in. Can you tell me just what is narcissism, just to get the lay of the land?
I'm happy to do that. So one thing I wanted to distinguish is there is a difference between narcissistic traits and then having the full-blown pathology, which we call narcissistic personality disorder or NPD. So having narcissistic traits is actually very normal. We all have them, especially as professionals and people that value success and career and, professionalism. We all have that sense of being somewhat narcissistic at times, which can be very self-preserving. But when it starts to affect relationships in all aspects of our life, professional relationships, personal relationships, it can trend towards the spectrum of NPD. So there's a bunch of kind of classic symptoms that I think we've all, as you said, have dealt with narcissistic people in our life. And it's really a pathology that stems, from an innate childhood trauma, where the person feels extremely insecure, but they are not in touch with their insecurity. And then this comes out in this outward manifestation of being very grandiose, very self-important, having intense fantasies, which they may or may not express about being very successful, very powerful, very beautiful, belief in superiority, need for admiration, and entitlement. And there's also can then trend into some of the more malignant pathology where they're willing to cause harm to each other, to other people, or willing to exploit other people for their own gain. A lot of times they display a lack of empathy, just an inability to have, recognize the feelings of others, and they have an innate sense of envy. And again, this isn't always so obvious. There is the overt kind, which I think we all can spot readily. That very intense, grandiose, arrogant person that I'm sure we've all met, versus the covert narcissist, which is a little bit more insidious and a little harder to spot.
So that's a really interesting point because when I see those overly sort of grandiose people, I often view them as pompous rather than sort of narcissistic. So how do you differentiate between someone who has like a true personality disorder versus someone who's having just a quality here or there? Like how do you make the distinction?
And that's a great thing. And it's really challenging to spot, but that really goes back to where their sense of entitlement and their grandiosity is coming from. Is it coming from a deep sense of insecurity and lack of self-esteem? Or is it coming from some sort of wish fulfillment or career propagation or something of that nature, And again, with most things in this field, it's a spectrum. So there are people that kind of fall on the more benign end of the spectrum, and then there are people that trend to that more malignant, they can be extremely emotionally, even physically abusive. They can use coercion to get what they want. But when it starts affecting all aspects of their life, that they struggle with their children, they struggle with their partner, they struggle with professional aspects, that would be more in the realm of the full-blown personality disorder.
So when people have narcissistic personality disorder versus narcissistic traits, are narcissistic traits something that need to be treated, or as long as they're not affecting your life, it's fine to not treat them?
Oh, yeah. I mean, again, we all have them. We all, if you look at any personality disorder, most of us that are very functional people have some of these maladaptive traits that can come out when we're in whatever our trigger is. And as long as we're a little bit more cognizant of it and we don't, let that run our lives and we have some sense of understanding and some sense of ourself and taking responsibility, it's not really anything that requires treatment. I'd say the majority of us are pretty attuned with ourselves. Like we know if we did something wrong, we know if we, hurt our partner or hurt our child, and we're apt to say, I'm sorry, I did that. And, I want to do better. But the narcissist can't do that. Like the narcissistic personality disorder can't do that.
And is it true that if you have a personality disorder, especially narcissistic personality disorder, you're not someone who knows that you have it?
Well, you don't want to take accountability. So the hallmark of the narcissist is they don't think anything is ever their fault. And they might say, yes, that's true, but you did A, B, and C. So the blame is always shifted from the individual with the NPD to an external factor. They're often the victim, they're the savior of a story, but they're never the responsible party.
And so how do you address that? Like, how do you even treat that? Because you had mentioned that, parents can have it. So obviously that's really
Yeah.
frustrating trait for a child to deal with a parent like that. Like, what can someone who has, when we're in our 30s and 40s and, we might have parents in their 60s and 70s with narcissistic personality disorder. How would you advise someone to go about even approaching a situation where they wanted to improve a relationship with a narcissist?
So with the person with the NPD, they have to be willing to want to change. They have to say, I've noticed that this is affecting my life and I want to make meaningful change. And if they're willing to do that, there's certainly hope. There's definitely types of treatment modalities that they can employ. But unless they have some small glimmer of they need to take that accountability, it can be extremely challenging to deal with the narcissist. So the treatment for the individual that may have a narcissistic parent or a narcissistic partner is really focused on them and them setting healthy boundaries, them learning how to communicate with these people that, especially the people that they can't cut out of their lives. Like, and some people do cut out narcissistic and toxic parents, or they limit their conversations with them.
So, what would you say is the biggest myth about narcissistic personality disorder that you've seen through your clinical career?
I'd say the biggest myth is that the somebody external to the person can change that person. That person has to be wanting to explore why their relationships have been problematic or their professional career has been problematic, and they have to be willing to actually make meaningful change. Somebody outside that can identify that this person has NPD, while that's great that they've identified it, the person that's actually has the disorder has to have that awareness or has to at least be willing to work with a skilled professional to gain that awareness. So that's probably the biggest myth, is that you can't force somebody to change. And that's really true of anything in psychiatry. The person has to be willing to want to do the work and change themselves.
So, if a person is willing and wants to do the work, is that primarily going to be therapy, or are there also medications that people have used to assist in kind of breaking that cycle of narcissism?
It is mostly therapy, intensive psychotherapy. They can do a range of cognitive behavioral therapy, dialectical behavioral therapy, couples work. If there is comorbidity of trauma in their childhood, we certainly can treat like PTSD with medication. Narcissists tend to have a higher comorbidity of depression and anxiety. So we can definitely treat those things with medications, SSRIs, or, what have you. But you can't treat the actual NPD with a medication. That's all therapy.
So, since you are a child and adolescent psychiatrist, how common is it to see narcissistic personality disorder at a young age? Is it something that you see in children and adolescents?
I would never diagnose somebody in a young age because people are still developing. I mean, I would say that people with a narcissistic parent are much more apt to develop NPD as they become adults. But I think I think it would be remiss to diagnose somebody with NPD before they've had the chance to develop. I mean, I believe it's not able to be diagnosed before the age of 18. But I would even go well into the 20s and see them really have some life experiences, see how relationships are before I would really diagnose somebody with that.
And is there anything that a parent can do to help ensure that a child develops like good social skills and good habits in terms of things like you mentioned, like developing empathy? Like, how do we as parents try to not model narcissistic behavior to our kids?
There are some studies, and nothing's ever really been causally shown, but that helicopter parenting is causing more narcissism in our children. So, kind of letting your children have the space to make mistakes and be supportive and promoting more of that unconditional love will definitely help that child develop those social skills and resilience.
That's really interesting because you're totally right. Like, I don't remember any situations where I've gotten into a fight when I was little and my parents like called the other
Yeah.
person's
I don't
parent.
even think my parents knew my friends.
Yeah.
They probably didn't think I had any.
Yeah, I don't think that ever happened.
They
So,
would have never called my friends' parents, never in a million years. But
yeah.
now that is so commonplace.
That's true. It is very commonplace. I think it's kind of, you have to judge, is this bullying where we need to get parents involved
Right,
or a higher kind of authority involved? Or is this just like, hey, I'm not getting along with someone? Well,
right.
we're
And
all not
maybe
going to get it.
it's totally situational. Obviously, it's bullying, then the school should get involved or a teacher, whoever the adult is. But if it's something else, and maybe you would be better served by teaching your kid resilience and how to navigate that rather than going in and fixing their problems. So again, that's not always, I don't want to imply that helicopter parenting is going to lead to narcissism, but helicopter parenting does seem to cause less of an ability for a child to problem solve on their own.
Right. And the limited ability to problem solve could probably also mean that the child is not comfortable making mistakes and
Exactly. Yeah.
never wants to
Yeah.
take blame for everything,
Right. Right. Right.
want to ever admit that anything could be their fault because of
Hmm.
the expectations that parents potentially have set on them.
Right. Or if they've all cleared all their obstacles from a young age, and then they have this maybe false sense of they did everything correctly, because there was never a chance to fail.
Right. You have to let your kids fail a little bit.
Hmm. Yeah.
Really.
And that's, I think, just a general, not just about narcissism, though.
Hi, everyone. If you've enjoyed this interview thus far, be sure to hit the like and subscribe button below. It not only helps the channel, but helps out all the people that we interview. Thanks for watching. Fact or fiction, is narcissistic personality disorder more common in men or women?
It's generally more common in men.
Wait, so why is that? Do we know why that is? Is it just, again, the upbringing or how men are treated differently as children, or were they treated differently? Do we have a reason to understand that since it's clearly not genetic?
Right. We don't really have an understanding about that. And I think as we are seeing more, you know, this is being more talked about, we are kind of seeing that there's different types of narcissism. I would say men are more likely in general to have narcissism, but I think that there are women that display narcissism as well. But I think, in my opinion, and this, I don't think that there's any data on this, but in my opinion, women are more likely to display what we call covert narcissism rather than the overt narcissism. So it might just not be as easily spotted. But factors that go into that, genetics, having a narcissistic parent, they can all play into that.
Oh, so
And trauma, childhood trauma.
genetics does play a role.
Yeah, yeah. I mean, if your parent was a narcissist and that's how they parented and you saw them that way.
But is that nature or nurture? That's what I'm wondering. Because with
I think
genetics, we would think it would be nature. but is it just nurture that they've been around them?
With anything, it's probably both, you
But
know?
one of the things that I really wanted to talk about was, being in a relationship with a narcissist. And I know we talked about the parent relationship, child, and of course, friends and siblings. But, romantic relationships, obviously, especially when the male is a narcissist, I think have really been a subject, a popular subject that people have talked about recently. So
Hmm.
how does someone, and this is male or female, is there a way to identify a narcissist early on? So if it's not something you're interested in being in a relationship with, you can sort of make your way out.
Sure. No, and I think that's a great question. I think it's really challenging to spark the narcissist in the beginning because in the beginning, what the narcissist does is this term love bombing, right? Which feels really, really good, you know? And the narcissist is so adept at making you feel special and making you feel like you're the only person that gets them, you know? Which, I mean, of course, makes anyone feel good. But I would say like that love bombing is probably something to be a little wary of. But I also don't want it to be to the point where people can't just accept that there's a nice human being that likes them too, you know? So, the love bombing is something that I think is very characteristic of the narcissist, and especially in those early stages. Whether you would see that before you actually start dating them, that would be a little bit murky. But one thing you could do before you start dating them is asking them about previous relationships and see what their accountability level is and why some of their previous relationships didn't work out. So if the person is always blaming somebody else, it was never their fault, they were always the victim, this person did this to me, I was perfect, that would be a major red flag, you know?
Yeah, that's because no one's perfect.
Exactly. Now, if they took some accountability, and you could they could still take some accountability, and that could be part of their love bombing, So, it's very challenging to spot until you're actually in it, you know?
Are there some common sort of phrases or things that narcissists do in relationships that are kind of characteristic?
So, they usually in the beginning have an idealization phase. So, kind of that love bombing of like, you're just the best person ever. I've never met anybody like you. You're just the most gorgeous, the smartest, whatever, comments, and then that might last for several months, and that's why it's so tricky to be with a narcissist because once you get through this phase, the partner of the narcissist is always trying to get back to that phase because that was the best part and it was wonderful and life was idyllic, and the partner thinks they've also met their soulmate, but then that quickly turns into this devaluation phase where there it can be subtle at first, snotty comments, like any kind of thing to put their partner down, so that can range from just mild criticisms, passive aggressive comments, and then a worst case scenario, of course, physical and emotional abuse.
And do narcissists lie or do they just not take accountability?
They can do both, but it's almost like they live in their own reality in a way because and that's kind of where the gaslighting comes into because like something the partner will have said, well, you said this, and then the narcissist was like, I never said that, you're crazy, I never said that. And you could even have a record of it and be like, they could deny it, like they are masters at denying everything, even if when faced with extreme proof, and then when they're caught in their lie and they're starting to feel insecure, you'll see that narcissistic rage come out where they just explode and get angry and the partner kind of retreats, because they just want to keep the peace. And then the cycle just continues on and on and on.
So really, really interesting thus far. So someone who might be watching this and maybe they identify that they are in a relationship with a narcissist or someone who has some deeply narcissistic qualities, are there any tools that they can use? Do they necessarily have to not be with this person, or are there tools and things that they can do to improve their relationship or improve how they're experiencing their relationship?
Sure. I mean, I think that if you're in a relationship with a narcissist that shows absolutely no sense of accountability and no sense of changing, the prognosis for that relationship is pretty poor. Um, but there are some times where you still have to have that person in your life, say, they're the parent of your child or somebody you can't really excise. So you will have to learn strategies to deal with this person because it's just not always possible to cut them out. So that's where you have to, seek your own therapy. You have to really set your boundaries. You have to realize that you are not crazy. If you know something to be true, you can't let this person make you feel like you're crazy if you know that what they said was in fact said. And you have to learn to not react because the narcissistic really feeds off of that reaction from what we call from their supplier. So it's this concept of narcissistic supply that the narcissist needs to constantly belittle somebody to fuel them. So if you don't give them that reaction, like if you don't show that you're upset when they are horrible to you, eventually they'll get tired of it and they'll move on to their next target.
So for someone who may be co-parenting with a narcissistic ex-wife or ex-husband, what are the ways that they can deal with issues that happen around their children to
Mhm.
minimize any impact on what the children see and experience through the co-parenting?
Yeah. So that's a great point. So with somebody with narcissism, they very rarely can co-parent. So what you'll have to do is something called parallel parenting. So basically you won't have control over what's going on in that other household, and you just have to model, empathy and love and trust in your household. Because with somebody with full-blown NPD, if you try to have these conversations with them, likely they will explode and then attack you. So you have to just be as supportive with your child as possible, model good behavior, and just, kind of do the very best you can. But it's very challenging to co-parent with a narcissist because to they don't want to hear your feedback or of something that they may be doing that is wrong or detrimental to the child because that will spark their own feelings of insecurity and then they will rage. So with a parent, a cope with a like if you're in a relationship where your ex is a narcissist and you happen to have a child together, the best thing to do is keep everything you know, either via email or text so you have a paper trail, not respond to they will try to incite you. So try to not react. They say go gray rock. I don't know if you heard that term, but it's like the gray rock technique, which is basically like you're just a rock. They will say anything to you and you are completely placid and you don't give them the response that they so desperately crave. And you keep your interactions with them brief, you keep them informative, and you keep them firm. So you just try to communicate as much as possible in these very challenging times if you have a narcissistic ex with a child.
Do children in that situation also need therapy? Because I imagine, you're not going to tell your child, oh, well, your dad or mom is a narcissist. So, like,
Yeah,
how?
no, definitely, because the narcissistic parent can be really doing a lot of harm to their child. A lot of times narcissistic parents view their children as just extensions of themselves. So they don't really see them as individuals. They are very happy if that child is succeeding. They can get very angry when that child is struggling. Also, they can use money to control them. They have a sense of conditional love, not unconditional love. So that child can feel very insecure and very um, unrooted, when dealing with that parent.
And so, as the other parent, what are some of the things that you can do in terms of just having those initial conversations without being accusatory towards the co-parent? Because I can't imagine that that's going to lead to anything good.
Right, exactly. I mean, I would probably censor it just on the child's emotions. Like, how did that make you feel? And, everyone struggles, and it's okay you didn't get a, A on that test. And, you know, many people have had these kind of failures, and just trying to reinforce that what they're dealing with is totally normal and should not be a condition of a parent loving them.
Thanks so much for being here. This was super interesting. For anyone that is in the state of Missouri that wants to see you either in person or via telehealth, what is the best way for them to find you?
They can just search my name, Shauna Shah, SHAH, or SDS Psychiatric Services in St. Louis, Missouri.
Awesome. Thanks so much.